Venetoclax, it's a relatively new drug. Can you tell me what you're doing with it here in the setting of relapsed or refractory multiple myeloma? You've got a couple of studies. Tell me what you were trying to investigate with these.
Right. So venetoclax or ABT199 is an oral inhibitor, which is a specific inhibitor of Bcl2, and it has been in clinical trials for several years now, mostly in the CLL space. But more recently, there's been clinical trials that are being done for multiple myeloma as well.
Why are you hoping it will work in multiple myeloma then?
So a lot of the myeloma cells actually do express high levels of Bcl2. So there's a good reason to believe that this drug might have an activity in multiple myeloma as well.
We've got a couple of studies. One is using this drug together with bortezomib and dexamethasone, the other using it as monotherapy. Can you tell me about both of those two studies?
Sure. So the venetoclax or the ABT199 single agent study is essentially a phase 1-2 study that's examining the best dose of venetoclax that can be given these patients. And we also want to see if there's any signal in terms of efficacy. So roughly about 60 patients have been enrolled on this study. We know what is the maximum tolerated dose. It's about 1200 milligrams daily. And that actually is not the maximum tolerated, but that was the planned maximum dose in the study. And we did not see any dose-limiting toxicity with this drug.
What did you see?
The main side effect has been some GI side effects and some drop in blood counts.
What did you see in terms of efficacy then?
So we saw 5 responses among the 60 patients, which included two patients with complete response and 3 patients with a very good partial response with the single agent venetoclax.
Okay, so there's response with single agent. Mm-hmm. What about the combination work then?
So the reason why we looked at the combination is because those do synergize in the in vitro preclinical studies, and there are some mechanisms for why the bortezomib can make the ABT199 work better or the other way around. And so the combination study also, we did not reach a maximum tolerated dose, and the expansion phase is using the maximum planned dose. And the regular dose of Velcade is used in these clinical studies. Now, in terms of efficacy, in patients who have never seen a proteasome inhibitor, all of them had a response. In patients who have previously seen bortezomib but have not become resistant to bortezomib, we did see about 70% response rate, but very low response rate in people who have previously been refractory to Velcade. But overall, the combination seems to be fairly interesting in terms of its efficacy and its tolerability.
What then do you think this might be telling cancer doctors about the potential clinical use of this oral Bcl2 inhibitor?
So I think the oral Bcl2 inhibitor is probably going to have a role to play in the multiple myeloma field, but obviously we need phase 3 trials, and those are being planned in combination with bortezomib to see if we can actually get this drug to the patient.
Now, I think I noted somewhere that you detected, as a conclusion, no new safety signals.
Right. We don't see any major issues. It's very well tolerated.
As conclusions go, no new safety signals isn't telling you anything positive, is it?
No, it is. It is, because now we have, previously we had a very small cohort of patients, and now we have a much larger group of patients that are being treated in these clinical trials.
What might it promise in terms of efficacy?
I think there might be some biomarkers that could go with it. That is very exploratory right now. So there is a possibility we can identify patients who respond better to this drug, and if that does pan out, then you actually could have a biomarker-driven treatment selection.
So what should doctors take note of, in summary, from your findings so far?
So the main thing is it seems to be an exciting molecule, and stay tuned for the phase 3 trials.